So the population is projected to increase by 20 to 30,000 over the next 10 plus years. And it's anticipated that the current 3 practices will be taking on those patients rather than a new GP surgery being built. So we need to look at how we can increase our capacity to manage a larger patient list over time. We hope it's good news for our patients that we will be remaining on site, and we think we have enough room here to expand gradually and increase the area that we're using on this site to deliver primary care. So that will be a gradual change over time that the building enlarges, but fundamentally we'll be staying as we are on Coker Close. This is a process that we have gone through with the Oxfordshire Clinical Commissioning Group, as well as the other 2 practices, Montgomery House Surgery, who are currently opposite us, and the Alchester practice. And so together with those practices, we looked at all the options, and for us individually, that included the possibility of building a large surgery, multi-storied surgery on this site that could potentially accommodate both Montgomery House Surgery and our practice. But for logistical and financial reasons, that wasn't felt to be viable. We also looked at the option of moving with one or probably both of the other surgeries to a new site, which would probably be in one of the areas of new housing development, so on the outskirts of Bicester. And this option had many positives, such as a new purpose-built building, working closely with our colleagues on the same site, lots of parking, but would of course have meant the loss of our current central location, which for many patients who've been with us for a long time means walking distance or significant convenience. We're also close to the community hospital, and that in itself is useful for patients. So overall, we felt the best option for us was to stay on site, as we do feel we have room to expand. But obviously the set of circumstances and challenges that each practice faces is different. So the right solution is going to be different for all of those practices. So one of the disadvantages of the option of staying here has been that we won't be moving to a new site with unlimited parking, or certainly a lot more parking. We understand that there will always be patients who will need to come and park here because of infirmity and disability. And of course, there will always be the parking that is available in the future. But creating more parking is very challenging. So we'll be hoping that patients will think imaginatively about all the options there are to access the practice. And in fact, our patient participation group has been involved in producing this leaflet, which just outlines the other options that there are in terms of park and ride and the bus services to the practice. We'll be involving our patient participation group in the decision we've made and looking for any feedback that they might have in terms of patient attitudes or concerns as to the changes we're making. But overall, we hope it's a good news message for our patients that we're staying on site, we're staying where patients have been used to seeing us, and we anticipate doing so for the foreseeable future.